Anaphylaxis is a severe allergic reaction that needs to be treated right away. If you have an anaphylactic reaction, you need an epinephrine, adrenaline, shot as soon as possible, and someone should call 911 for emergency medical help. Left untreated, it can be deadly. Epinephrine can reverse the symptoms within minutes. If this doesn't happen, you may need a second shot within half an hour. These shots, which you need a prescription to get, come pre-filled and in ready-to-use pens. You shouldn't take an antihistamine for an anaphylactic reaction. It's a good idea to wear a medical alert bracelet or pendant or carry a card with information about your allergy. If you've had an anaphylactic reaction before, you have a higher risk of having another one. You also have a higher risk if you have a family history of anaphylaxis or have asthma. The first signs of an anaphylactic reaction may look like typical allergy symptoms. A runny nose or a skin rash. But within about 30 minutes, more serious signs appear. There is usually more than one of these. Coughing, wheezing and pain, itching, or tightness in your chest. Fainting, dizziness, confusion, or weakness. Hives, a rash, and itchy, swollen, or red skin. Runny or stuffy nose and sneezing. Shortness of breath or trouble breathing and rapid heartbeat. Swollen or itchy lips or tongue. Swollen or itchy throat, hoarse voice, trouble swallowing, tightness in your throat. Vomiting, diarrhea, or cramps. Weak pulse, paleness. Some people also remember feeling a sense of doom right before the attack. As many as 1 out of every 5 people may have a second anaphylactic reaction within 12 hours of the first. This is called a biphasic anaphylaxis. Epinephrine is the most effective treatment for anaphylaxis, and the shot should be given right away, usually in the thigh. If you've had an anaphylaxis reaction before, you should carry at least 2 doses of epinephrine with you at all times. Epinephrine expires after about a year, so make sure your prescription is up to date. If you have an anaphylactic reaction and the pen has expired, take the shot anyway. Anaphylaxis happens when you have an antibody, something that usually fights infection, that overreacts to something harmless like food. It might not happen the first time you come in contact with the trigger, but it can develop over time. In children, the most common cause is food. For adults, the main cause is medication. Anaphylaxis also can be triggered by a few other things. But these aren't as common. Pollen, such as ragweed, grass, and tree pollen. Stings or bites from bees, wasps, yellow jackets, hornets, and fire ants. Latex, found in hospital gloves, balloons, and rubber bands. In rare cases, anaphylaxis can be triggered by 2 to 4 hours of exercise after eating certain foods or by exercise on its own. Anaphylactic reactions usually start within minutes of contact with the trigger, but they can also happen an hour or more later. Some people never figure out what caused their reactions.